Hello mga Dokis! This is Doc Jean and welcome to Dental Life. On this video, we are going to discuss something quite sensitive that sent shockwave not only to the medical community but also to the dental community and other health providers because for the first time, there is a medical doctor and surgeon who was convicted of reckless imprudence resulting to serious physical injury, resulting for this said doctor to be imprisoned and died on October 5, 2023. And the doctor that I am pertaining to is Dr. Benigno or Iggy for short, Agbayani Jr. Now, I will briefly discuss his case and then I will provide certain commentary as a personal opinion because I have quite a unique situation on why I will say something on this case or the malpractice case per se. Now, according to the Supreme Court Third Division notice that Dr. Agbayani that on or about January 5, 2006 in the city of Manila, Philippines, the said accused being the surgeon and or orthopedist of the complainant, Sol Hofileño Jr., did and then and there voluntarily but without malice conduct an operation arthroscopy upon said complainant in a reckless manner by using a medical instrument arthroscope that was not sterilized without taking the necessary precaution to avoid injury to the said complainant, taking into consideration his employment or occupation and degree of intelligence, causing as a consequence of his said carelessness, recklessness, negligence, imprudence, and lack of precaution, the said complainant to suffer serious physical injuries on his left knee, which rendered him incapacitated for work and or labor for more than 30 days. And in fact, the said complainant had undergone another operation at St. Luke's Hospital, Quezon City, on his left knee to remove the infection introduced by the accused and subsequent operation on his right wrist. As a result of walking with the cane for a prolonged period of time to the damage and prejudice of the said Sol Hofilenia Jr. Agbayani pleaded not guilty to the crime charge. Thereafter, a trial on the merits ensued. So, mga dokis, it is about an infection that was created due to the unsterilized instrument that was used by Dr. Iggy during the operation. And this trial resulted to a guilty verdict. Although Dr. Iggy's lawyer has filed an appeal, this was turned down because of the following reasons: that the petitioner appealed before the RCT on September 3, 2013. Thereafter, on October 11, 2013, the RCT ordered him to file a memorandum of appeal as per Section 7B, Rule 40 of the rules of court. Thus, the petitioner had until December 4, 2013, within which to file his appeal memorandum. However, instead of filing his appeal memorandum, he filed a motion asking for an extension of 15 days, which was granted by the RCT in its December 16, 2013 order. Hence, the petitioner had until December 19, 2013, within which to file his appeal memorandum. However, he failed to do so. Now, mga dokis, as I have read the ruling of the appeal of the Supreme Court, it seems that the lawyers of Dr. Agbayani Jr. was not able to really file the required filing at the specified time required by the court. And then, in addition to that, they are not able to submit the proper documents per requested by the court. Now, what are my thoughts on this? Now, first of all, mga dokis, as I have said, I have a unique position on why I want to comment on this case. One, because I am considered as a doctor being a dental professional. Second, I am also a victim of medical malpractice. In fact, I became a handicap at the age of 2.5 years old by a doctor who unfortunately inadvertently hit my sciatic nerve when she was injecting me with anti-tetanus, resulting for my left leg to get paralyzed and for me to become a handicap for the rest of my life. Now, mga dokis, oftentimes we automatically think two things. One, the doctor is so evil that they committed an unforgivable sin. So, of course, on the side of the patient, this doctor should be imprisoned, lose his license, and provide financial compensation. On the side of the doctor, automatically, if a patient complains, they think it is about financial gain. Now, I will comment on these two things because, yes, there are times indeed these assumptions may be true. But in the Philippines, rarely a patient will be able to get financial gain unless before it goes to trial or during the trial, the complainant and the doctor was able to negotiate and agree on a certain settlement. However, mga dokis, depending on the malpractice case and the effect of what the doctor inadvertently did to the patient, no amount of money will be able to compensate the result of that medical mistake. Mga dokis, no amount of millions of money will I want to be handicapped for the rest of my life. So, in the end, in the court of law, unfortunately, the only compensation of a patient when they become a victim of medical malpractice, the only compensation that the court will be able to give them is financial compensation. Now, mga dokis, it does not mean that the patient will live happily ever after because they were able to get a certain amount of money. Remember, depending on what was the result of the medical malpractice, for example, in my case that I became a handicap, that amount of money will end up being spent on further medical treatments and other treatments that will enable me to live a normal life. Unfortunately, on my part, mga dokis, and that is again the second contention why a patient will just file a case against a medical or a dental or a health practitioner for money is because unfortunately in the Philippines, justice is not served because it takes too long. On my part, mga dokis, it went over almost 20 years to the point that four of the judges already died. My father died. Everybody died, including the doctor who did this to me, to the point it becomes mute and academic, and you just let it go. But in the end, who is suffering until now? And that is the patient, on this case, me. So, mga dokis, don't think that automatically that money will truly compensate a patient who became a victim of a medical malpractice. Now, on the side of the medical doctor, I believe that in normal circumstances, with normal mindset, no doctor or no health practitioner are going to intentionally hurt their patient. And because we are also human, mistakes do happen. Unfortunately, we have to accept the fact, mga dokis, that it does not matter what did you do as a doctor, the good things that you have done to your patient, or what are your qualification, although it will come handy during the trial. But in the end, it will be a question whether you are truly guilty of negligence or malpractice. Because the issue here is what your action did to the patient. And of course, the background or the qualification you have will help a lot to defend yourself that you did not make a mistake, and the good things that you have done previously to your other patient can also be entered as evidence for your defense. Unfortunately, all of these things is nothing if you are proven by the court to be guilty of negligence or malpractice on that act or case itself. So in the end, both sides are in a very hard and difficult situation. And in the Philippines, unfortunately, most of the time, the part of the advantage is always on the professional. Why did I say that? Because unfortunately, not all doctors have the money to shell out and be able to really give the financial compensation that the patient truly deserves to have, or there is no medical malpractice insurance here. And a lot of the professionals, especially in the health professionals, are bound together, and rarely will there be another professional, like for example in the case of Dr. Iggy, will you be able to find another orthopedic surgeon who will testify against Dr. Iggy during a trial? That is why the complainant's witness is based on a pathologist and a medical technologist. This just proves, mga dokis, that it is truly sad that it happened wherein Dr. Iggy was not able to finalize his appeal in regards to his verdict. And I believe there is a question wherein the relatives and the friends of Dr. Iggy not to focus on what the patient did to Dr. Iggy, because I believe if Dr. Iggy was found guilty of that act against this patient, then the patient is just also fighting for his own justice. And the thing that the relatives and the family of Dr. Iggy can do is question the competency, in my opinion, Dr. Iggy's lawyer, because it seems that his appeal was denied due to certain technical conditions that his lawyers were not able to submit in the court. So that is precisely the reason why this is very important for me, because mga dokis, as I have said, I have experienced not once, not twice, but 3 times in terms of medical malpractice. And in principle, I always believe, especially in my practice and in my personal life, that do not do unto others what you do not want others to do unto you. So before we say bad things and bash the patient, because Dr. Iggy passed away in prison, it is not the fault of the patient. And Dr. Iggy's fight for cleaning up his name on this situation will probably, unfortunately, will die on his passing. Now, the question now is whether the patient filed a civil case to get the damages that the patient believes he deserves. Now, on behalf of me personally, I truly feel sad and give my condolences to the family of Dr. Iggy Agbayani, even if I don't know him personally. But as a colleague in the health profession, of course, it is truly sad that this has happened. Now, mga dokis, this case has a very important lesson for us, because by personal experience, there is a reason why a patient will end up suing you, even if there is a possibility wherein you can truly be able to de-escalate the situation and avoid any legal impediment. Now, personally, this is my advice to you, mga dokis, because these are the things that I believe a patient will end up truly filing a case against a doctor, especially on conditions that will provoke them to do so. So, number one, mga dokis, in order for you to avoid this, set aside your ego. Let's admit it, mga dokis, when you are a doctor, whether in the medical or in a dental profession, we kind of develop a certain ego within ourselves, to the point that when your work is being questioned or there is a complaint being forwarded to you, instead of you listening and be emphatic about it, your tendency is to react defensively. And this will definitely not de-escalate the situation, but rather make it even worse. Second, treat what you can do, especially if it is an emergency case. Now, what is very good in terms of dentists is rarely we are in a situation that we can actually kill a patient. But these do happen in cases of oral surgeons and oral maxillofacial surgeons. Now, anything that has surgery on it, the risk of the patient in getting worse situation becomes higher. So if that is the situation, mga dokis, do the treatment first without mga dokis admitting any liability or fault. You can use certain words and be able to really be careful in the manner on how you talk to your patient. Now, I truly, truly encourage you to record either video or audio during that discussion. Now, if the patient doesn't know that you are recording them, this cannot be used in the court of law. However, this can be used as a negotiation between you and the patient if the patient ended up lying in the affidavit. This will allow your lawyer to be able to negotiate with the lawyer of your patient. However, it is a lot better if you are able to convince your patient to record the discussion for the patient benefit as well as your own. But make sure, mga dokis, that when you are discussing this to your patient, you are not combative or defensive, and emphasize more on the benefit for the patient rather than yourself. Then the third, mga dokis, if you can handle it, charge the patient only at cost for this retreatment or emergency treatment, or do not charge the patient at all. Kasi mga dokis, believe me, having a malpractice case is more expensive and a lot more stressful and complicated than just letting go of the cost of whatever you need to do in order to handle the current situation or complaint of your patient. Now, before I further go to the next other things you need to do in order to prevent further legal impediment or litigation, mga dokis, if you like this video and you feel that you are learning from dental life, give me a thumbs up, subscribe, hit that notification bell so that every time I upload, you will be notified. And also, mga dokis, do comment below on what you think about the case of Dr. Iggy. What is your position? So, mga dokis, also, I would like to really encourage you to attend my Smart Management Dental Life program, because these are the things I do discuss there. What are the legal identity that your dental business should have so that in case of litigation, you will be protected. Also, mga dokis, in my program, you have the chance to choose if certain modules are the only modules you want to enroll it online, and this is 24/7 available, mobile ready, and you can choose whether you want to have a one-on-one session with me, like if, for example, you want to have a personalized discussion of your actual situation in your dental practice in order to build a good business plan, or do you want to have a live skills training that will apply the management to this and how you can increase profit in your dental practice. So, the Smart Management Dental Life program, mga dokis, is very, very flexible in terms of time, money, and plus, mga dokis, 1,000 pesos of your enrollment fee, D&D Center will donate it to Queens of Mary, that is a foundation for SA children and women. They house them and educate them. So you do not only learn and ended up earning from what you learn from us, but also be able to give back and donate on this foundation. So, mga dokis, to continue, number 4, if the patient ended up preferring another dentist or another docky to handle the emergency treatment or the retreatment of the situation that the patient is complaining about, then make sure get a colleague that has an MS or a higher qualification than you are. Make sure that no stones are unturned to be able to ensure that no mistakes will happen again in the retreatment. And make sure you let this specialist or your colleague know the situation, have a discussion, record everything, and discuss it with the patient. And please, mga dokis, as I have mentioned, consider not charging anymore for the retreatment. Next, if the patient agrees for the retreatment, make sure that you have the proper documentation, especially a non-disclosure agreement, and as well as a patient's waiver on this retreatment, discussing specifically what are the do's and don'ts and what you agreed on, so that it is very clear what is the situation without admitting that you are in the wrong. Now, mga dokis, this is very important. When the situation already comes into play wherein you need to do a retreatment or an emergency treatment, the next thing that you should be contacting is a legal representation. This person will be able to guide you exactly what will be in the non-disclosure agreement and how you are going to discuss this with your patient so that you are guided properly on how you are going to address it and act accordingly in good faith. Next, mga dokis, as I have mentioned, not only the negotiation or the discussion between you and the patient, you and the specialist, you, the specialist, and the patient must be recorded or videoed. It is also best that you video the retreatment so that you have the actual evidence of what was done during the retreatment of the case in order to prevent further damage to the patient. Okay? So you have to provide also consent on this so that you have the actual thing and be able to present that during the retreatment, everything was done properly. Be very careful as well on the pre and post operative instructions. Now, the next that you need to avoid, which is the worst thing that you can do, is that when a patient is complaining something or telling you something that there is a problem, you ended up hiding from that patient or not talking to that patient. Mga dokis, if you do that, you escalate further your problem with that patient. The next is be very careful, mga dokis, with the words that you say, what you text, what you email to the patient. Do not further agitate the patient and make sure always that you are calm, willing to listen, and the patient should feel that you are empathetic and willing to help out the patient rather than being offensive. And the last advice I can tell you, mga dokis, is that once the patient files a case against you, do not communicate anymore further with the patient, but let your lawyer communicate with the lawyer of the patient. And if your lawyer will be able to negotiate with the lawyer of your patient, not to go through with the legal case, but instead negotiate and be able to reach an agreement that both of you can be happy about without leading and going to a trial, then it is much better. Now, if in case it does, mga dokis, my truest and sincerest suggestion to you is really prepare money for it, because you need to hire a very smart lawyer with certain influence in the court. That is a fact of life dito sa Pilipinas. Because at the end of the day, it is very important that your lawyer truly has experience in filing malpractice cases. A lot of lawyers doesn't even understand certain terminologies, and sometimes if you hire big law firms, the head lawyers is not even the people who will be handling your case. So make sure that the lawyer who is handling your case truly has the experience in litigation, and he or she is willing to really research on the case and be able to defend you at the best of his or her ability. Now, mga dokis, in case of Dr. Iggy, it is truly sad, but I don't believe that this will be a case that will snowball of people filing cases against medical doctors. Because honestly, mga dokis, it also takes a lot of money on the part of a patient to even file a case against another person. So, mga dokis, my best advice for everyone is first, do no harm. Make sure that you are truly qualified in doing the case. If you are not, then just refer it to another doci who can truly and safely do the procedure. Always put your patient's safety first. And precisely on Dr. Iggy's case, it is not even his inability to do the procedure, but due to infection control. And as I have always teach and very passionate about infection control, please do the protocol. I do have the entire suggestion of what are the basic infection control, and you can watch that video, especially intended for dental practice. Also, mga dokis, do watch how you will be able to handle disgruntled patient, because these are the things you need to know in order to de-escalate the situation and prevent it from leading to further legal litigation. Now, mga dokis, I hope you will continue to support Dental Life and do comment below so that I will be able to continually support you in creating, building, growing, and sustaining your dental life. This is Doc Jean. Always stay safe and be healthy. Bye!